So let's quickly look at the next concept right here before us. This is the Maternal Death Review. Maternal Death Review Form. So a woman died because of a procedure, right? Not procedure, because of pregnancy. Yeah, it could be procedure during the pregnancy and all of that. So after she died, you guys in your clinic, you are kind of like trying to be remorse about it, not taking it like, okay, it's an ordinary, next patient died and all of that. So you're actually trying to review this and trying to, look at the reasons why she died. Of course, you are looking at these reasons. This is because you want to know what killed her, and this will help you prevent it next time. Sometimes you might be doing this because of an investigation and all of that. So maternal death review is just a form. It's used to collect and analyze data, all right, on maternal deaths, okay, with the goal of identifying what made a woman died, okay, knowing the factors involved, and this will help you guys to be able to improve on the type of care you give to pregnant women. All right, so the type of information you might actually need to collect in a maternal death review form is her age, the number of pregnancies and births she has ever had, gestational age, okay, the age at which she actually died, the age of the pregnancy at which she died, So can you understand? You can pause to observe. This is another form here, okay? So section 2, medical history. You talk about any other disease conditions she has ever had that possibly contributed to the death, okay? You talk about pregnancy complications, he had any. Talk about previous surgical procedures or medical procedures she ever had. Then circumstances of death. Talk about the place of death. Talk about the cause of death. Talk about any factors that actually contributed to the death. Okay. So healthcare provider information. So healthcare provider is just information about what healthcare providers involved in the woman's care. You understand? So all the doctors that did, all the nurses that were involved in the care, their names will be there. All right. So level of care, right? What type of care was actually rendered to the woman should all be documented. Then review of the care provided, including if there was any delays. Recommendations. So you now say possible things that could have been done that would have prevented this woman from dying. Okay. So these are the possible informations you have in a maternal death review form.